Okay, what's up, guys? So I put together a list of high yield PANCE terms that we should know when preparing for the PANCE. So I put this together in kind of a random quiz-like order so we can basically just actively recall. I'll give a kind of a moment of silence in between the association and the term so that we can kind of think about it if you're just listening. And of course, if you're actually watching the video and me scroll through the terms, then you'll obviously see the answer, but otherwise, just listening, hopefully it will pop up in your head, and that will hopefully be a good way to study. So we'll start with bag of worms. So bag of worms will make you think of varicocele. So that's that dilation of the venous plexus around the scrotum. So varicocele is bag of worms. For boggy uterus, if you hear boggy uterus in a question, you want to think of adenomyosis. So boggy uterus, adenomyosis, not fibroids, not endometriosis. So boggy uterus, adenomyosis. Smudged cells on the peripheral smear. Smudged cells on the peripheral smear, you want to think of CLL. So how you can remember that, somebody said crushed little lymphocytes, CLL. Chronic lymphocytic leukemia, that's smudged cells on the peripheral smear. So what is a steeple sign on X-ray? And a barking seal cough. So steeple sign on X-ray, barking seal cough, you want to think of croup right away. So croup, steeple sign on X-ray, or a barking seal cough. If you have a patient with a palpable olive-shaped mass, or also string sign, which is the long, narrow, which gives it away, pyloric lumen, you want to think of pyloric stenosis. So palpable olive-shaped mass, string sign, you want to think of pyloric stenosis. And this is also non-bilious vomiting with pyloric stenosis, not bilious vomiting. What's the thumbprint on X-ray? Thumbprint on X-ray is epiglottitis. So that's that lateral X-ray, thumbprint on X-ray, epiglottitis. And most common cause from epiglottitis is HIB, HIB, Haemophilus influenza B. And now since the vaccines come out, it's streptococcus now. So thumb sign on X-ray, you want to think epiglottitis. If you have a patient with a cherry red spot or fovea or a pale optic disc, you want to be thinking of a CRAO, central retinal artery occlusion. So a cherry red spot or fovea and a pale optic disc, central retinal artery occlusion. If you have somebody with a blood and thunder appearance, a blood and thunder retina, hemorrhages or exudates, you want to think of a CRVO, central retinal vein occlusion. So for rust-colored sputum, what does that make you think of? Rust-colored sputum, strep pneumoniae. For current jelly sputum, you want to think of Klebsiella pneumonia. And what else for Klebsiella pneumonia? Also alcoholics too. So Klebsiella pneumonia, current jelly sputum. After a viral URI, they're having pneumonia. What does that make you think of? Potentially Staph aureus. So after a viral URI, you want to think Staph aureus. For a chest x-ray that shows honeycombing, so chest x-ray that shows honeycombing, you want to think of pulmonary fibrosis. The Signet ring sign in tram track appearance, what does that make you think of? Bronchiectasis. So bronchiectasis, Signet ring sign in tram track appearance. Also, what's the most common bacteria in bronchiectasis? That's going to be Pseudomonas. So Pseudomonas, most common bacteria, Signet ring sign in tram track appearance, and that's for bronchiectasis. So what's unilateral ptosis, meiosis, and anhidrosis? So unilateral ptosis, meiosis, and anhidrosis, that's Horner syndrome. So Horner syndrome, unilateral ptosis, meiosis, and anhidrosis. So anhidrosis, dry eyes, meiosis, narrowed pupils or constricted pupils, and ptosis is drooping of the eyelid. When you hear parenchymal bullae or subpleural blebs, especially an older patient, that makes you think of emphysema. So for emphysema, parenchymal bulla, and subpleural blebs. If it's a young patient with blebs, that could make you think of a primary spontaneous pneumothorax as well. So young patient with blebs, spontaneous pneumothorax, or if they're an old patient with emphysema, you want to think parenchymal bulla or subpleural blebs. Hot potato voice, What does hot potato voice signify? That would be a PTA, a paratonsillar abscess. So hot potato voice. Pharyngeal gray pseudomembranes. So pharyngeal gray pseudomembranes. What does that make you think of? Diphtheria. Electrical alternans in a low QRS voltage. Electrical alternans in a low QRS voltage. That makes you think of a pericardial effusion. And these are the EKG findings of a pericardial effusion. So electrical alternans, low QRS voltage for a pericardial effusion on EKG. So electrical alternans is the heart bobbing around in the fluid. So because the leads are on the chest, it's moving closer and further away. And that's the same thing for the low QRS voltage. So if you see a cobblestone pattern on colonoscopy, what does that make you think of? Crohn's disease. So cobblestoning is Crohn's disease. And also for Crohn's, you'll have what other physical exam and imaging findings? There could be skip lesions, terminal ileus, a string sign, which is the sign of Cantor, on barium enema. If you have Reed-Sternberg cells, that makes you think of Hodgkin's, whereas non-Hodgkin's does not. And remember, is Hodgkin's a contiguous spread, or does it spread all over the body? Hodgkin's spreads contiguously. So Hodgkin's spreads contiguously, Reed-Sternberg cells. Non-Hodgkin's can spread all over the body, especially the GI, and it does not have Reed-Sternberg cells. If I say current jelly stools, sausage mass on abdominal exam, dance sign, which is no bowel sounds in the right lower quadrant, or a target or donut sign on ultrasound, what does that make you think of? Intussusception. So current jelly stools and the sausage mass on abdominal exam, dance sign, target or donut sign on ultrasound, that's intussusception. And remember, intussusception is that colicky pain, so it comes and goes. And kids will often flex their hips or bunch up into a ball to decrease that pain as well. So very colicky, intussusception. So if they have carpopedal spasms or Chvostek sign or Chvostek sign, which is a facial twitch, or the Trousseau sign, which is the blood pressure spasming of the blood pressure cuff, and perioral numbness, what does that make you think of? Hypocalcemia. So hypocalcemia. What would we see in hypercalcemia? That would be the stones, bones, abdominal groans, psychiatric tones, etc. For a bird beak on barium swallow, that makes you think of achalasia. So bird beak on barium swallow, that's achalasia. If I say Heberden's nodes, which are in the DIPs, or Bouchard's nodes, which are in the PIPs, that makes you think of OA, so osteoarthritis, for Heberden's and Bouchard's nodes. If there's Kovner's phenomenon, which is a maculopapular rash from scratching the areas, you want to think of juvenile RA. This is also in psoriasis and lichen planus as well. So that's Kovner's phenomenon in juvenile RA, psoriasis, and lichen planus. Swan neck deformity, boutonniere deformity, subcutaneous nodules on the extensor surfaces. You want to think of RA for this, rheumatoid arthritis. So rheumatoid arthritis, swan neck deformity, boutonniere deformity, subcutaneous nodules on the extensor surfaces. So how about the pencil and cup deformity on X-ray of the proximal phalanx, and also nail deformities? So pencil and cup deformity and also nail deformities, you want to think of psoriatic arthritis. So psoriatic arthritis, pencil and cup deformity, and also the nail deformities. The Tenniel sign or the Phelan sign. So the Phelan sign or the Tenniel sign. So Tenniel is tapping over the median nerve, and Phelan sign is putting your hands in like this for over 1 minute, leads to pain in the median nerve distribution, and that's carpal tunnel, of course. How about distal radial fracture with dorsal angulation and a dinner fork deformity? So distal radial fracture with dorsal angulation and a dinner fork deformity. You want to think of a Colles fracture or a Colles fracture. And how about the opposite of that? A distal radial fracture with volar angulation. So a distal radial fracture with volar angulation, that's the opposite, that's Smith's. So that's Smith's fracture. What does it make you think of if there's a bamboo spine on x-ray? So young male, bamboo spine on x-ray, difficulty breathing as well. You want to think of ankylosing spondylitis. So that's one of your seronegative spondyloarthropathies, and that's your parapneumatic psoriatic arthritis, ankylosing spondylitis, intestinal arthritis, and reactive arthritis. Bamboo spine on x-ray, ankylosing spondylitis. If you see the crescent sign on x-ray, so crescent sign on x-ray, you want to think of avascular necrosis of the hip. So crescent sign on x-ray, avascular necrosis of the hip. And what if you see the ice cream cone sign on x-ray of the hip? Then you want to think of SCFE, slipped capital femoral epiphysis. So SCFE, slipped capital femoral epiphysis, is with an ice cream cone sign. UCL sprain, the ulnar collateral ligament sprain, you want to think of gamekeeper's thumb. So UCL sprain is the gamekeeper's thumb, also called skier's thumb too. If I say fat pad sign or posterior fat pad sign, you want to think of fracture, a supracondylar fracture. Forgot to write it here, but supracondylar fracture for a posterior or anterior fat pad sign, and that's hemarthrosis around the joint. So if I say anatomical snuff box, that'll be a scaphoid fracture. And remember, high degree of avascular necrosis, and it can also be negative on initial x-rays. So if you're suspecting a scaphoid fracture, you can come back and re-x-ray them a few weeks later, or you can get an MRI if the suspicion is high, and they should always be splinted with a thumb spica splint. So if you see anatomical snuff box, you want to think right away scaphoid fracture. How about amyloid plaques in neurofibrillary tangles? So amyloid plaques in neurofibrillary tangles. You want to think of Alzheimer's for that, Alzheimer's disease. So amyloid plaques in neurofibrillary tangles are some of the causes of Alzheimer's disease, or the proposed mechanisms anyways. How about battle sign? What do you want to think of with battle sign? Is a basilar skull fracture. So battle sign, also raccoon eyes, or a mastoid ecchymosis. In battle sign, you want to think of basilar skull fracture. How about white blood cell casts? So white blood cell casts, you want to think of pyelonephritis. So white blood cell casts, pyelonephritis. How about epithelial casts? If they have epithelial casts, you want to think of ATN, acute tubular necrosis. Hyaline casts. If they have hyaline casts, you want to think of an acute renal failure, or this could also be athletes. So oftentimes an athlete after running and they have something where they get hyaline casts, you want to think of just an acute renal failure if it's in athletes. Pedunculate bone mass capped in cartilage. So pedunculate bone mass capped in cartilage. You want to think of osteochondroma. So pedunculate bone mass capped in cartilage, osteochondroma. Renal tubular epithelial cell casts, and these are muddy brown casts. So renal tubular epithelial casts, muddy brown casts. That would be ATN again. So acute tubular necrosis. How about Goutron's papules and a heliotrope rash? So Goutron's papules and a heliotrope rash. So Goutron's papules are scaly papular rash on the dorsum of the hands, and a heliotrope rash that makes you think of dermatomyositis. So dermatomyositis. How about red blood cell casts, RBC casts? That makes you think of glomerulonephritis. How about a low morning cortisol with an elevated ACTH? So a low morning cortisol with an elevated ACTH. So elevated ACTH, the pituitary is trying to stimulate the adrenal gland, but it can't. It can't produce any cortisol due to that. And typically in the morning is when we measure the cortisol. That's when it's its highest. So this would be Addison's disease. So Addison's disease. Positive Finkelstein test. So positive Finkelstein test is you're making a fist and you're doing ulnar deviation. and that's de Quervain's tenosynovitis. So Finkelstein's test, which is the ulnar deviation, you're going to have de Quervain's tenosynovitis. If there's an over 125 milligrams per deciliter urine cortisol in 24 hours, moon facies, and a buffalo hump, that makes you think of Cushing's. So that makes you think of Cushing's disease. Moon facies, buffalo hump, purple striae, as well as poor wound healing, all makes you think of Cushing's syndrome or disease. And which one is Cushing's syndrome and which one is Cushing's disease? Cushing's disease is a pituitary cause, and Cushing's syndrome could be another cause. So like small cell lung cancer, any other ectopic creation of cortisol. So cortisol in Cushing's syndrome is coming from somewhere else in the body. Cushing's disease is a problem with the pituitary itself. So if there's milkman lines or looser zones, so milkman lines or looser zones, which are pseudofractures, that makes you think of osteomalacia. So osteomalacia for milkman's lines and looser zones. How about a snowstorm on transvaginal ultrasonography with an elevated beta-HCG? So snowstorm on transvaginal ultrasound with an elevated HCG, so a massively elevated HCG. And it could also be called a sack of grapes or grape-like vesicles. And that's a high datidiform mole, so a molar pregnancy, a high datidiform mole. And which type of high datidiform mole, partial or complete, does have fetal tissue or does not have fetal tissue? So a complete mole does not have any fetal tissue, and a partial mole has some fetal tissue, but it's also never viable. So if you have eruptive and tendinous xanthomas, what does that make you think of? Eruptive or tendinous xanthomas. That will be the hyperlipidemia skin findings. And those can be on the extensor surfaces, also in the eyes as well. So in hyperlipidemia, you have those eruptive and tendinous xanthomas. How about classically, a petechial rash with meningeal symptoms? So what bug is that? Petechial rash with meningeal symptoms. You want to think of Neisseria meningitidis. Neisseria meningitidis. If there's a rope-like, quote unquote, on clinical breast exam, and also changes with menstruation. So a rope-like mass felt on breast exam, and also changes with menstruation. You want to think of fibrocystic breast changes. So fibrocystic breast changes, as opposed to a fibroadenoma. How about KOH with hyphae and spores in a spaghetti and meatball-like appearance? So spaghetti and meatball-like appearance, KOH with hyphae and spores. You want to think of tinea versicolor. So tinea versicolor, and that's typically on like the upper back as well. How about a Harold patch with a Christmas tree rash? You want to think of pityriasis roseae. So heralding patch in a Christmas tree distribution, you want to think of pityriasis roseae. So S-shaped burrows in the skin, or permethrin 5% cream as a treatment. You want to think of scabies. So treatment for scabies is that permethrin 5% cream and an S-shaped burrows in the skin. If I say onycholysis with oil spots, so onycholysis with oil spots, you want to think of psoriatic nails. So those are the psoriatic nails. So the findings in psoriasis will be onycholysis with oil spots on the nails. What's the most common cause or the most common bug in hot tub folliculitis? So the most common bug in hot tub folliculitis will be Pseudomonas aeruginosa. So oftentimes things with water will be Pseudomonas aeruginosa, except for the cause of like ventilator or air conditioning acquired pneumonia, which would be what? That would be Legionella. So that'd be Legionella. So if you have blue linear lines on the nails, Kaiser-Fleischer rings, which are the green, yellow, brown rings in the iris and cornea, what does that make you think of? So that makes you think of Wilson's disease, which is a copper deposition disease. So Wilson's disease. And how do you treat Wilson's disease? What are the treatments of Wilson's disease? How I remember that is TZD6. So trientine, zinc, D-penicillamine, with B6. So TZD6 is for Wilson's disease, and some of them are chelating agents because we want to kind of chelate the copper so we can get rid of it. And that's different for plumism, which is lead overdose basically, and that's with succinylcholine is first line for plumism. So again, Wilson's disease, TZD6, and you're going to see those Kaiser-Fleischer rings in the eyes, which is the pathognomonic thing. And for plumism, succinylcholine is the first line chelating agent. So egg on a string appearance, what does that make you think of? So egg on a string appearance, and making it a little bit easier, a narrowed mediastinum in a newborn, let's say. This will be transposition of the great vessels. So transposition of the great vessels, egg on a string, in a narrowed mediastinum. How about absent or decreased femoral pulses with a murmur, lower blood pressure in arms versus the legs, and also a figure 3 sign on chest x-ray. So figure 3 sign on chest x-ray, lower blood pressure in the arms versus the legs, and an absent or decreased femoral pulse with a murmur. That's coarctation of the aorta. So very important, coarctation of the aorta. What if I say a boot-shaped heart, a ventricular septal defect, an overriding aorta, and also pulmonary stenosis, and right ventricular hypertrophy? So that will be the tetralogy of Fallot. So tetralogy of Fallot, what are the 4 things found in tetralogy of Fallot? That's going to be the VSD, the RVH, the pulmonic stenosis, and the overriding aorta. So machine-like murmur. So definitely associate machine-like murmur with a patent ductus arteriosus. So PDA, machine-like murmur. And how do we close a PDA? So how do we close a PDA? That will be indomethacin. So an NSAID blocks the prostaglandins. So that's how we can also explain how we keep it open if we need to in things like transposition of the great vessels. So we can give prostaglandin in that case to keep it open, or indomethacin, a prostaglandin antagonist, to close it. So again, PDA, machine-like murmur. What if you have a Scotty dog appearance? They say a Scotty dog appearance on spinal films. You want to think of spondylolysis, which is different from spondylolisthesis. So spondylolisthesis is the actual movement of that vertebrae due to the fracture, but spondylolysis is just the lysing of the pedicle itself. So that's the pars interarticularis that gets lysed, and that's the classic Scotty dog appearance on lateral spinal films. So spondylolysis. What if you have somebody that's having an inability to pass the NG tube in an infant? So inability to pass the NG tube in an infant. That'll be choanal atresia. So choanal atresia, inability to pass an NG tube in an infant. How about an apple core lesion on barium enema? So an apple core lesion on barium enema, what does that make you think of? Colon cancer. So colon cancer, apple core lesion on barium enema, colon cancer. And which side of colon cancer, the right or the left, is more associated with bleeding? So which side of colon cancer is more associated with bleeding? The right side more associated with bleeding, the left side more associated with obstruction, because it's more narrow, so it can be obstructed more easily, and bleeding from the right side. How about Courvoisier's sign? What is Courvoisier's sign, and what does that signify? So Courvoisier's sign is a palpable, non-tender gallbladder. So if you feel a palpable, non-tender gallbladder, that's Courvoisier's sign, and that's signifies pancreatic cancer. And what is the cancer marker for pancreatic cancer? The cancer marker for pancreatic cancer is CA19-9. So again, pancreatic cancer, CA19-9, Courvoisier's sign, palpable, non-tender gallbladder. How about if you have a lead pipe deformity? A lead pipe deformity. This is loss of haustral markings on barium enema. So lead pipe deformity, loss of haustral markings on barium enema, you want to think of ulcerative colitis, as opposed to Crohn's, which were those skip lesions. So the Crohn's was skip lesions, and ulcerative colitis is the lead pipe deformity, which is those loss of haustral markings on the barium enema. And what is Charcot's triad? So Charcot's triad, fever and chills, right upper quadrant pain, and jaundice, and that's indicative of ascending cholangitis. So especially ascending cholangitis with Charcot's triad, fever and chills, right upper quadrant pain, and jaundice. And then what is Raynaud's pentad? So Raynaud's pentad is fever and chills, right upper quadrant pain, and jaundice, plus altered mental status and hypotension. And all of those things, either the Charcot's triad or the Raynaud's pentad, can be found in ascending cholangitis. So if I say a positive whiff test, clue cells on the wet prep, you want to think of BV, bacterial vaginosis, and this is Gardnerella vaginalis. So which type of vaginitis will have an elevated pH? So there's two that will have an elevated pH and one that will not. So BV, as well as trichomoniasis, have an elevated pH. So in BV, you have the lack of the acidophilus, which is the acid-loving bacteria. So with a lack of the acid-loving bacteria, you have a more basic pH. So that explains the elevation of the pH in BV. And of course, trichomoniasis, just remembering that trichomoniasis does have an elevated pH. So BV and trichomoniasis in over 4.5 pH, as opposed to Candida, which does not. So Candida will have a more acidic pH that'll be under 4. So BV and trichomonas over 4.5, and Candida under 4.5. And again, BV, clue cells on wet prep, and a positive whiff test. So I've heard for the PANCE, they also don't use specific pathognomonic terms as much anymore, but they might say clue cells on wet prep, and they might say epithelial cells surrounding they might say bacteria surrounding an epithelial cell, for instance, as opposed to clue cells, because that's too obvious. So, like we said, what do you think of with strawberry cervix? So strawberry cervix, you want to think of trichomonas right away. So strawberry cervix, trichomonas, or trichomoniasis. And what is the treatment for trichomoniasis? That's going to be metronidazole, so flagyl. How about a bird beak deformity on x-ray? Bird beak deformity on x-ray, you want to think of achalasia or a sigmoid volvulus. So it depends where you are. If you're imaging the lower abdomen, sigmoid volvulus from the sigmoid colon, or achalasia. They're both bird beak deformities on x-ray. Hyphae and buds on KOH prep. So hyphae and buds on KOH prep, you want to think of vaginal candidiasis. And of course, the pH on vaginal candidiasis, that'll be under 4.5. So gonorrhea and chlamydia, chandelier sign on exam, which is cervical motion tenderness, chandelier sign on exam, and the most common causes are gonorrhea and chlamydia, can also be polymicrobial. You want to think of PID. So patient who's sexually active, having right upper quadrant pain, what is the diagnosis? Is it gallstones, or is it Fitzhugh-Curtis syndrome because of PID? So that's a good one to know. Strep pyoderma, and a honey gold crust on the face. So a honey gold crust on the face, as a cause, and the cause is strep pyoderma, you want to think of impetigo. So impetigo, that honey gold crust on the face. It could also be described as a varnish-like appearance. So a varnish-like appearance for impetigo. Okay, and we'll stop there for this video, and I'll continue along with more pathognomonic terms in the next one.